Hi there, I'm Sharon Morgan from TameMyPain.com and I'm a psychologist specialising in the treatment of chronic pain. This is a short video about understanding chronic pain, including what pain actually is, how we feel pain, and the difference between acute and chronic pain. It can be a confusing area for sufferers, especially if many doctors and specialist opinions have been sought, operations have been done, and lots of medications and painkillers have been trialled, but the pain is still there. If this has been your experience, then perhaps a very different kind of approach is needed to get a better quality of life, but more on this later. Okay, let's start with the basics. We know you suffer with pain, but what exactly is it? The next part is a little bit complex, but stay with me. I'll make it as simple as I can. It's helpful to understand why we feel pain in the first place. When we injure our bodies, the tissue damage activates sensors called nociceptors, and this is the beginning of our pain experience. We find that gaps in our small blood vessels widen, allowing in plasma as well as other specialised cells that lay down collagen. This process results in scar tissue forming to help heal the damaged area. Pain message information is sent from our damaged nerves to our brain via the spinal cord. It's only when these messages are received and interpreted by the brain that we experience pain. Now, it's really important to understand that everyone experiences pain differently. If you and I were carrying the same injury, I might rate the pain as, say, an 8 out of 10 on my pain scale, and you might only rate it as a 3, and both pain ratings are just as valid as each other. It just makes treatment a bit tricky for the doctors. Pain is usually categorised by how long it lasts. So if we're talking about acute pain, we would actually mean short-term pain that is directly related to your physical injury. It usually lasts less than 6 months, give or take, and depends on the kind of injury it is. This kind of pain often responds well to non-prescription medications, heat, ice, and massage. Now, when we're talking about chronic pain, we mean long-term pain lasting more than 6 months despite medical treatment. This kind of pain may no longer be explained by your original injury. Unless there is a specific disease related to the pain, such as rheumatoid arthritis or cancer, this kind of pain may not be a warning sign of new damage. So, if despite medical treatment your pain has persisted longer than 6 months and is beyond what would be expected by medical professionals, then there's a good chance you're suffering with chronic pain. If you do suffer with chronic pain, it can be classified in the following ways. Nociceptive pain. This is pain that has lasted over 6 months and is very clearly related to ongoing tissue damage. Now, this could be some types of cancer, bone infections, or arthritis. Another type of chronic pain is called neuropathic pain, and if you suffer with this, your pain is caused by damage relating to your nerves. A memory of pain is formed, and sometimes this is described as feeling like stabbing or shooting pains, electric shock-like feelings, sensations of being crushed, or sometimes it can just feel like a constant but intense ache. Because of its unusual nature, health professionals find neuropathic pain really tricky to treat. Unfortunately, some of my patients have been told it's all in your head. So I want to reassure you that this kind of pain is real. It just requires some understanding and new ways to manage it more effectively. If you would like to learn more about how to treat chronic pain using proven psychological strategies that really work, then visit TameMyPain.com. My ebook, Tame My Pain, has everything you need to take control and start living the life you want. Take care of yourself.